Hello, everybody, and welcome to another edition of For the Health of It, a new segment on health and fitness dedicated to getting important health information out to you and our wider community. Today, our discussion is on what's new with COVID-19. There's a lot in the news. There's a lot of new research and information that is out. There are a lot of things that new models are predicting, and we feel that it is important to get this information to you as soon as we get it. And we have a great asset and professional here today. Our guest today is going to share with all of us the latest information on COVID-19 and what you can do to protect yourself, your family, and be prepared for the upcoming shifts and waves that are being predicted for the future. And so our guest this evening is Dr. Adjoa Smalls-Mantey. Dr. Adjoa Smalls-Mantey is an ER psychiatrist. She has her PhD in HIV and vaccine-related research. She also works with media outlets providing medical reviews as well. So we are grateful to have such a gift and a blessed and competent person to come and talk to us about COVID-19 and about vaccines. Dr. Adjoa Smalls-Mantey, welcome, and thank you for joining us today.
Thank you.
Dr. Adjoa, officials are saying that there could be as many as 100 million new COVID infections this fall. Why may so many people get COVID even when much of the population is already vaccinated?
So the first thing to know about getting a vaccine is that it's not to prevent you from ever getting sick, it's to prevent you from getting seriously deathly ill if you do get infected. So even though many of the people in the US have been vaccinated against COVID, there is a chance that they may have breakthrough infections if a more contagious variant comes around, like the current Omicron variant. And so they're thinking right now, if people do not continue to get boosters, if a new super variant arises, that we may have more people get infected. And so that's why there have been urgent calls to increase our funding and to keep up our efforts in trying to detect the virus, to treat, to develop new vaccines that can combat it. Sadly, right now, a few people are getting breakthrough infections. Unfortunately, some people died, but largely the vaccines are very effective in keeping people safe from getting seriously ill with COVID.
Okay. Thank you. What should you do? What should a person do if they find themselves getting sick with COVID right now?
So the first thing to do is to make sure you don't spread it to somebody else. So isolate yourself. And that is, being by yourself for about 5 days. If you're feeling a little bit better, you can be around other people, but still within 10 days, you want to make sure that you're taking precautions, wearing a tight fitting mask, definitely not going around anyone if you've had a fever, not traveling. Tell your close contacts that you have tested positive for COVID so that they can also be aware and maybe quarantine if they have to. But if you do get COVID and you happen to have a higher risk of getting a severe infection, say that you're a little bit older, like over 50, or if you have underlying health conditions, you're immunocompromised, consider getting one of the treatments that is available. We have 2 pills and we have some monoclonal antibodies that are available, the Paxlovid, the Molnupiravir, Remdesivir, other antibodies are available for you, but you have to get those very early in your infection. So as soon as you know and you're high risk, talk to your doctor about that.
Okay. All right. Thank you. You spoke about some of the older, more vulnerable populations. Now, what about those younger groups? When will a vaccine be available for children under age 5?
We're hoping very soon, maybe next month by June. Right now, we currently have a vaccine for kids 5 and older, but Moderna has just put in their application for a vaccine for emergency use authorization for children 6 months to 6 years old. Pfizer has requested boosters for the older children and is expected to put their application for children under the age of 5 in by the end of the month or early June. So
Okay.
hopefully going into this summer, children will now have the opportunity to get vaccinated. And that means that almost everyone in the family can be vaccinated and much safer from COVID.
Wonderful, wonderful. Dr. Joe, you do such a wonderful job getting this information out to our community, to our lay folk who might not understand all the details of the research and what is out there. So thank you for making this information accessible and making it very plain. You also have done something else to kind of help make this information very practical for families. You recently co-authored a book, a children's book. Could you tell us a bit about it?
Yes, I co-authored the book, Anjali the Brave, all about vaccines. It's a children's book where a little girl who's nervous about getting a vaccine goes to visit her doctor and learns about how vaccines have been very helpful for us in the past and how they can be helpful for us in the future. So I do hope that it helps people feel more knowledgeable about medications and treatments that they have received and will be receiving in the future. And it's available at Amazon, Barnes and Noble, any other retailer where ebooks are sold.
Wonderful, wonderful. Thank you so much. So you heard that, everybody. Get the book and Jolly the Brave, and make sure that if you don't have children, share it with other kids, maybe in your family or in your community. It will bless them and help them understand what we're in and just the efficacy or the safety of vaccines. So again, thank you so much, Dr. Smalls-Mantey, for sharing this very vital information for us. This blessed me, and I know it's going to bless our wider community. And thank you, everyone, for coming and joining us for another segment, another edition of For the Health of It. If you enjoyed this, please like, please share, please subscribe, please follow us, and share this with somebody else who you know it will be a blessing to. Until then, may God bless you and keep the faith.